my name is Abigail and I'm going to be doing my assessment on my mother. Can you state your name and date of birth?
Dawn Testa, 8/5/55.
All right. And when was your last bowel movement?
20 minutes ago.
Wonderful. And get down. Have you noticed any problems when you're walking, like banging into objects or tripping on things that maybe you wouldn't ordinarily trip on?
No.
Okay. And then when you're doing your basic activities around the house, do you feel like you have full range of motion, or is there any muscle pain that's inhibiting you?
No.
All right. And then I'm going to note general appearance of the skin. Everything looks good. Patient is alert, sitting up, seems to be able to hear fine, so that indicates that her vestibulocochlear acoustic nerve is intact. Let's see. Do you know what season it is?
It's autumn.
It is. It's autumn. And do you know where you are?
In my kitchen.
Good. And actually we'll do that later. So I'm going to start by assessing her abdomen. So I'm going to palpate in all 4 quadrants and then auscultate in all 4 quadrants. And before I started the video, I inspected the abdomen just for privacy of the patient, and it's got a rounded contour, it's symmetrical. I didn't notice any pulsations, and no veins were present, no drainage or swelling or abnormal redness. So now I'll just palpate lightly and then deeply all 4 quadrants and then auscultate in a clockwise manner, I guess. And tell me if there's any pain or tenderness. You have very firm abdominal muscles. You really do have very firm muscles, I feel like. Alright, and then I'm going to auscultate. The right upper quadrant, left upper quadrant, left lower quadrant, and right lower quadrant. And then to assess for bruit, I'll use the bell of my stethoscope. All right, so let's see, this is your right side. So the right lower quadrant is probably the noisiest right now, but it's just gurgling every 5 to 10 seconds. There's a high-pitched gurgle or a click. So vowel sounds are present in all quadrants, not hyperactive, not hypoactive. I'd say they're normal active. So that's the abdominal assessment. And then I'm going to go on to the assessment of the cranial nerves. So I'm going to start with optic, and I'm going to have you, so the optic nerve number 2, I'm going to have her read my badge. Can you read that?
Abigail Testa.
All right, and next I'm going to do oculomotor. So this is the 6 cardinal gazes and perla, and I do not have my pen light on me, I just realized. But we'll see what we can do. Maybe we can just phone flashlight. And also I'm going to assess her confrontation. So for perla, I have my pen light, so I guess this makes it a little bit difficult, but let's see, we can use a phone flashlight. And when I'm assessing for perla, I'm just making sure that her eyes are accommodating, that they're round and reactive to light. What is your flashlight like? Oh, thanks. You can look up. Can you look up a little bit more? The kitchen is already pretty bright, so I didn't see a lot of dilation or constriction with the light shining in there, but every pupillar reaction seemed to be normal. I'm going to attest for accommodation. I'm gonna hold this out here and I'm gonna slowly bring it in closer to your eyes, and I'm watching for convergence of her eyes. Good job. And then her 6 cardinal gazes. You're just gonna follow my. Wonderful. Keep your head still. All right, 6 cardinal gazes. So that was testing her oculomotor 3, 4, and 6. So oculomotor, trochlear, and abducens nerve. And next I'm going to test her trigeminal nerve. So for this one, I am going to have, should we do trigeminal nerves? Yeah. I'm going to have you clench your jaw, and I'm going to feel right back here. This is the muscle of mastication. So go ahead and clench your jaw. And then relax. And do it once more. Alright, so I can feel that clenching back here on that jawline. Next, I'm going to test her facial nerve. So I'm going to have you raise your eyebrows. And then puff out your cheeks. Good. Alright, next I'm going to do we already did the acoustic or vestibulocochlear nerve just so she can hear and she seems to understand what I'm saying, so there's no, do you feel like you have any trouble with hearing?
Nope.
Okay. Next I'm going to do the glossopharyngeal. So for this one, I'm going to test glossopharyngeal and vagus 9 and 10 together, and I'm going to have you make a guttural sound. So I'm going to have you open your mouth, and I'm going to grab this flashlight again, and you're going to say ah, and I'm going to watch for your soft palate and uvula to rise. Let me grab the flashlight real quick.
Ah.
Can you shake your tongue out? And now say it.
Ah.
Good. Soft palate and uvula both rose. That's our dog. Good dog. All right, and then next I'm going to I'm going to test her spinal accessory nerve. So I'm going to have you shrug your shoulders. Because there's a dog in this video. I'm going to have you shrug your shoulders. One moment. Come here. All right, go ahead and shrug your shoulders. And I'm going to push down. So go ahead once more. And then slowly relax. And once more. Okay. So I would grade that a 5 when I had my hands on her shoulders. I was not able to push them down unless she allowed me to push them down. And then next I'm going to do the hypoglossal. So for this one, you're going to put your tongue out to the left side and then out to the right side. Like that. Good. All right, everything looks good there. Just want to make sure that the face is symmetrical when she's smiling. Good. All right. And next we are going to assess your musculoskeletal system. So I'm going to have you stand up. Put this down. All right, and I'm just going to have you perform basic range of motion. Can you move over a little bit? So lift up your arm and see if you can move your shoulder fully. Good. Other arm. All right, and now can you do maybe stabilize with the hand on the table and see if you can do the same thing with your leg, just out and back. Oh. Okay, all right, that's good. And then next leg. You don't have to hit the chair. All right, and same with your ankle.
No fridge either.
All right, hold my hand maybe for stabilization and just move your ankle. Just doing ankle circles, making sure that she can move properly. Good, next. All right, you can take a seat. All right, now I'm gonna have you grab my 2 fingers with both of your hands and then squeeze progressively tighter. And now looser, progressively looser. Good, so that was just to test her grips. Everything seems to be normal there. And then next we are going to do the push and pull of her upper legs and then her feet. So what I'm going to do is I'm going to have you put your arms out like this. And I'm going to push against them. And you're going to resist. And now I'm going to pull and you're going to resist. Good. Same thing with your legs, put them flat. and I'm flat like this, and I'm going to push, and you're going to resist. Oh yeah, try a little bit. And I'm going to pull, and you're going to resist. Good. And then with the feet, I guess it would be testing that plantar flexion and dorsiflexion. So I'm just going to push and pull on the feet and make sure that she has enough muscle to resist that.
Yeah, you do.
All right, everything looks good down there with the push and the pull. Last thing that I forgot to note earlier was basic muscle development, and it seems like after doing her push-pull test and seeing her stabilize herself when she was performing her range of motion test, that everything looks good there. Do you have any questions?
No.
All right, that is all.